Welcome to The Proof, where we dissect the truth behind trending stories and viral claims. I'm Darshan Usman. Today, we'll be exploring a topic that has sparked significant concerns across social media: the ongoing Mpox outbreak and a video of the World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, that has been circulating online. Now, this video shows Dr. Tedros reversing a global health emergency declaration within days of it being announced. But is that really what happened? We'll get to know on this episode of The Proof, powered by Africa Check. To help us get to the bottom of this, I have Keegan Leach, Africa Check researcher, joining me now. Hello, Keegan. Thank you for joining us.
Thank you for having me, Darshan.
Let's dive right into the core of this issue. Now, on 13 August 2024, the Africa Centers for Disease Control and Prevention declared an Mpox outbreak mostly affecting the Democratic Republic of Congo as a public health emergency. The next day, the World Health Organization, that's the WHO, followed suit, declaring it a public health emergency of international concern. So shortly after the WHO labeled the Mpox outbreak a public health emergency of international concern, a video surfaced showing Dr. Tedros reversing this declaration. What did your investigation uncover about this video?
The clip that's been circulating is actually an old one, taken out of context. It's from a press briefing delivered on 11 May 2023, where Dr. Tedros announced that a 2022 outbreak of Mpox was no longer considered a public health emergency. That outbreak had been declared a public health emergency in July of 2022. It's driven by a different clade of the virus than the more recent outbreak.
So the video being shared now is from an entirely different context. Are we looking at a misunderstanding or deliberate manipulation regarding the WHO Director General's video?
The video does seem to have been deliberately taken out of context. The oldest version of this claim that Africa Check found was posted by an X account that is known for sharing false information. The user B Gates is a psycho, although the word psycho is misspelled in their handle, shared the clip in August 2024, implying that Dr. Tedros had reversed the public health emergency declaration just days after it was made. From there, other social media users reposted the clip or shared it to other social media platforms, and it quickly went viral.
That is very concerning, especially since public trust in organizations like the World Health Organization is crucial during health emergencies. What are the implications of spreading such misinformation during an active outbreak?
The implications are serious. Misinformation in a situation like this can lead to confusion or mistrust of public health authorities, which can in turn undermine efforts to control the outbreak. This kind of misinformation can also lead people to doubt the legitimacy or the seriousness of an outbreak, and that can lead to non-compliance with health measures intended to keep people safe. In a situation like this, where timely and accurate information is vital to controlling the spread and the impact of an outbreak, misinformation like this can even endanger lives.
This is a good place to take a breather, Keegan. Now, when we come back, we'll look at the differences between the current outbreak and the one from 2022, and also share tips on what to look out for. Stay with us. Welcome back. This is The Proof, powered by Africa Check. Today, we're looking into a video supposedly from the Director General of the World Health Organization retracting his statement declaring the 2024 Mpox outbreak a global health emergency. Keegan Leach, Africa Check researcher, has provided evidence that the video in circulation is taken out of context and dates back to 2023. This latest outbreak has been found in the Democratic Republic of Congo, Burundi, the Central African Republic, Uganda, Cameroon, Kenya, Rwanda, Sudan, Sweden, and Thailand, a total of 18 countries. For both Clade 1 and Clade 2, Over 120 countries have reported Mpox cases between January 2022 and August 2024, with over 100,000 laboratory-confirmed cases reported and over 220 deaths among confirmed cases. Now, what symptoms should people be on the lookout for?
So it's important to note that not everyone who gets Mpox will have all symptoms, but the important ones to look out for are rash, the most distinctive symptom, but also fever, headaches, muscle aches, low energy, swollen lymph nodes, back pain, and so on. Mpox can cause signs and symptoms which usually begin within a week, but can start within 1 to 21 days after transmission. The symptoms usually last for about 2 to 4 weeks, but they can last longer in people who have weakened immune systems. For some people, the first symptom of Mpox is the distinctive rash, but others might get fever, muscle aches, or sore throat first.
That's very important information, Keegan. We know that by ensuring people are aware and educated, we can make our communities safer from these outbreaks. It is also very crucial to understand these differences to prevent panic and ensure that responses are appropriate. But what about the broader issue of how such misinformation spreads? What can be done to combat the rapid dissemination of these misleading videos and posts?
Combating misinformation requires a multifaceted approach. Obviously, platforms like X and Facebook need to be proactive about labeling or even removing false information. Then, fact-checking organizations like Africa Check play an important role in debunking false information quickly after it appears. And public awareness campaigns are vital in educating people on how to critically evaluate the information that they see online. Encouraging the public to verify sources and cross-check information before they share it is vital to curbing the spread of misinformation.
Those are important points. But before we wrap up, what advice would you give to our viewers to help them avoid falling victim to such misinformation in future?
The advice is simple. Always check the source. If you come across a sensational claim or video, especially regarding health issues, take a moment to verify it. Look for trustworthy sources like the Africa CDC and WHO to see what they're saying. Be especially wary if information comes from a source or an account that is known for spreading conspiracy theories or sensational claims. And if something doesn't seem right, don't hesitate to ask questions or check it out a little bit before sharing.
Excellent advice. Thank you so much, Keegan, for helping us navigate this complex issue. It's clear that in today's digital age, staying informed requires diligence and a critical eye.
Thanks for having me, Dashan. It's been a pleasure to discuss this important topic.
And thank you to our viewers for tuning in to The Proof. If you have comments or claims you want us to fact check, tweet at AfricaCheck_NG. Follow News Central on our social media platforms at News Central TV. And visit our website. It's at www.newscentral.africa. Stay informed and stay alert. Until next time, I'm Darshan Usman, signing out.